Hello, it's Dr. Ott with the Doc and the Fam. I'm here to share with you some tips about breastfeeding and weight loss in your newborn. So it's important to know at the beginning that all newborns are likely to lose some weight. Up to 10% is considered normal. What? 10%? I know, it's a lot. If you're not prepared for that, then your newborn losing weight can be quite distressing. So I am telling you hopefully ahead of time. 10% normal. More than 10%, we get a little bit nervous about making a feeding plan, talking about supplementation, etc. If it is your first time, if you had a C-section, or if you did not have a great supply, you may have some anxiety about breastfeeding, about is my baby getting enough, etc. We have incredible expertise in our lactation consultants, so I invite you to avail yourself of the lactation consultants around you in your community. Get their hands on your baby, let them look at your latch, let them look at your angle. When I was breastfeeding my daughter, I was amazed at how just the tiniest little adjustment from this expert lactation consultant would make my experience go from a very painful latch that was kind of stressful to like, oh, this is fine, I could do this all day. So big difference. The way we try to get ahead of baby's weight gain is we make sure that we're feeding every 3 hours. And I count from the beginning of a feed, not the middle, not the end of the feed. We're like, if we started a feed at 8 a.m., we're going to start the next one at least by 11 a.m. All right. If they want it sooner, they're giving you cues like smacking and putting their fist in their mouth and kind of looking around for it like that. Those are cues. You're going to be reading those cues for that baby. They are saying, I'm ready to try to eat again. Okay. So doesn't matter how long you feed. I mean, it kind of matters, but like anything from 15 to 30 minutes is probably normal. Beyond that, you might be getting used as a human pacifier. Or it's possible that your baby might not be transferring milk super efficiently. So keep that in mind too. If the latch is painful, we have tools for that. We have nipple shields, which are silicone guards to help protect the skin. There can be cracking at the nipple. That is really important to know. Also, if you do have nipple pain and cracking, they will always offer you lanolin. There's also out there on the market by a company called Baby Carrots, there is something called Calendula Nipple Whip. That was my favorite topical product for cracked nipples. Such a game changer. If you have supply problems and you really want to augment your supply, you can talk to your provider about getting you domperidone. It's not actually FDA approved in the US, but it is approved in Canada, and you can have that risk-benefit conversation with your provider. No, I am not prescribing. This is a Doc and the Fam, so I'm giving information so that you can be prepared to ask the best possible questions for the best possible outcomes for you and your family. So let's see, what else do I want to say about breastfeeding? Every 3 hours, we're going to look for them to be satisfied, and we're going to look to how many voids they're having or how many wet diapers, right? We want them to be having as many wet diapers as they are days old. That is a really good sign that they are getting enough. So if they are at least 1 wet diaper in the first 24 hours, adequate. At least 2, adequate in the second day, and so on. If it's more than that, high five. You're doing great. This is kind of just our rule of thumb. When they're born, their little tummies are about the size of a big walnut, so there's not a lot of space to fill up in there, really. And I want to share also that if it continues to be a painful latch, I want you to look for these signs that your baby might have tongue tie. The fancy word for tongue tie is ankylosing, and it's when the frenulum, that little piece of tissue under your tongue to the floor of your mouth, is just tight. And a sign that it's tight is that when you stick out your tongue, there's a little bit of a heart shape there, or kind of like a cleavage, or the baby can't actually stick its tongue out past the lower dental ridge. Okay. That restriction has some significant implications, and we can fix it very easily, even in the nursery, with the quickest little snip of that tissue. The most gratifying thing, well, maybe not the most, but one of the very gratifying things I do in the nursery is help babies who have tongue tie to feed better. And the mom will be like, oh my gosh, that was 100% easier. That was so much better. And we're helping relieve stress, emotional burden. We're helping baby feel comfortable sooner. All the things. So if your baby has a tongue tie early intervention is better. It's just important to know about it because not everybody does. I hope that helps you, and I'm sure there will be more breastfeeding videos along the way.